Okay, first of all, Dr. Althea, welcome to Dimapur today.
Yes, thank you.
Can we know why is mental health important?
Mental health is important because it affects our thinking, the way we perceive, and our behavior. Manukhan face te khushi thakiliwi bitor de do duk khan pai thakiwo noliwi diktar khan do pai thake. Mohan icha mental health law upor de focus kurishe kule do it will really help our self esteem, our confidence. It will help improve our relationship and our productivity as well. Icharo, I think time huyeshe, Mohan sobbi Mohan la bhavna aro the way we think and talk about mental health, it should change.
So, doctor, why should we spread mental awareness, mental health awareness?
Mental health awareness spread growly, that's the need of the hour because bishi manukan mental illness per suffer kure, huliwi only a small percentage they come for help. And that is mainly because of the stigma that is associated with it. Mohan icha admit kurishe kule ki yes problem ase then only we can come up with a solution. Aro mohan icha itu mental illness ke fear aro shame kan surround kura to itu han to hatai diwole lage. Mohan awareness spread kurle manu khan bi ready thakiwo help luwo kane ahiwo kane aro tahan bi bujiwo ki acha mohan inika time de nolibi family members kan inika time de that's when they should come and seek help from a mental health professional.
So, Dr. Althea, can you name some few mental illness? Okay, so commonly, you come across, especially like Dimapur, Nagaland, na? Can you get patients can be face every now and then?
Mental illness kan kushikule to depression jawo, anxiety, OCD, schizophrenia, PTSD, ATPD, bishi thake. Holiwi Nagaland context tero सबसे common to anxiety ase, bishi de depression, aro ajikali to substance use disorder bi bishi ulai ja ase. Yete thaka manukan do bishi khan do alcohol de dependent thake, aro sunflower bishi khai. To tahan to inika stage te punchi chai where tahan icha sunflower la example kushe kule do sunflower na khale to tahan body ke bishi diktar pai family members ka tahan ke jabarjasti charuo lage biya ase koi thakiliwi noliwi tahan nijor wa charule mun jailiwi tahan la body ke iman diktar pai ki tahan ariwi sunflower he kha shuru hui jai to itu khan tam de ro they should come to a hospital where mukhan tahan la symptoms khan la opor de tahan ke treatment de aro tahan ke charule itu easier banai de.
Sunflower. So, sunflower addict manu ekta charule karne ki guru layo.
Sunflower charule asikule to first tahan yete aina mukhan patient ke assess kore like tahan kiman khai thakishe last kiman khaishe nakhatam de ki problem ulai itu kahan hua pishire side by side treatment thake by the psychiatrist and by the clinical psychologist as well. Aro accordingly we treat the patient. Icha tahan Nagaland te do tahan turkey koy na that means sunflower nakhatam de tahan problem khan bishi face kura like sukura pani ulawo nakpra pani ulawo pet khan jawo hath theng khan bishi bikhai kamhawale na pare restless hui jai to itu khan ke dawai khan thake medications khan thake itu khan ke treat kuro kane aro dawai itu sunflower khawoli bi ichha na that is craving itu khan craving khan ki kumti khan kuroli bi dawai khan thake to options khan to bishi ase.
So, kiman din na treatment te tai charule paru ekta patient.
Ito do any depending on the medications that we provide na medications kan bi bishi thake aro sunflower khan kha manu khan la mohan counseling khan be de to itu khan do vary kure it's not fixed for any one person because mukhan treatment khan de aro tahan kane ekta personalized treatment thake which means that itu ro tahan ikla la treatment ase it's never generalized.
Achha, can you please tell us like kiba specific cause khan asni ki to depression noili to one manu khan hui jato.
Causes kan icha to pinpoint to grow na paro holibi multiple causes thake two most important is the genetics aro environmental factors khan aro of course risk factors can be thake like icha manu khan all of financial problem nolibi suddenly bia news khan huna family khan der death khan hua noliwi going through a relationship problem itu khan multiple risk factors khan thake noliwi ekta family history thaka noliwi past history thaka enika
acha ekta inega mental illness ase koi na symptoms ki asu
symptoms khan to again it depends on the diagnosis aro ekta common example depression kushikuliwi duita manu they may have the same diagnosis but then they will have different presenting complaints so complaints are never the same it is always subjective but what we can watch out for are they can complain of low mood na like pula te tahan ki kura saman kan interest thaka ajkali ekdam interest na thaka hui jai nolibi energy level kan ekdam low hui jai sleep appetite kan affect hui jai to inika kurna these are the common symptoms like arubi ala khando concentration kan reduce hui ja confidence kan ekdam kumti hui ja inika
okay doctor says sometimes I feel low okay then down okay so iniga ru bisi I mon chinta hui jai iniga time tibi ki psychiatrist sabo lagi ni
chinta khan to any common thake holibi if you think that utu specific worry to apni la bishi time khai diye ase nolibi apni la functioning khan ke affect kore ase then you can definitely come aro apni mon du kwa nishina as humans we go through multiple emotions in one day so sometimes when we feel low sati khan loge nolibi family khan loge khota khan koile to that can really help but if you feel that bishi hui ja ase no it's becoming worse nolibi it's persisting over a couple of weeks then you can definitely come and get an evaluation done
okay Dr. Althea the medication bala therapy bala kuntu bala mental health issue garne nole mental health garne
duita option bi bhali ase if one person will respond to medication it does not mean that a second person will respond to medication as well na to patient khan aishikule do mo khan assessment kora pishire depending on their need and requirement we give them the option of medications or therapy
also Dr. Althea the psychiatrist or the psychologist itu duita to difference to ki ase
psychiatrist as in mohan MBBS first kore aro MBBS kora pishire we specialize in that particular subject na psychiatry aro as psychiatrist we prescribe medications aro psychologist ko kushikule do takhan they deal with therapy and counseling
Dr. Althea agi definitely kushe Nagaland te manoli stigma with this psychiatrist kiba kibi khan elaborate olo bhal ra ko parbo de ki la stigma ase aro manon kile mental illness supportive psychiatrist khan lot na je reason to ki ase ko parbo
manu khan do inika koe ki mental supposing depression asikule do everyone has their own opinion we usually if they see anyone being depressed then they say oh get over it oh ukunoe itu khawi nolibi inika kuriwi ekdam bar bhal hui jabo if a person has anxiety then oh itu han kanikile chinta kore ase chinta kurole ko kam nai it's all in your head inia han comments kan pass kore aro manu khan itu bi koe ki itu bimar lagise matlab mohan apni khan la forefathers khan ba sin khan kurala icha consequence face khan kore ase to ineka han man rumors iman myth khan do thake regarding psychiatric illness to manu khan problems khan face kuri thakiliwi ta khan they are a little bit hesitant to come forward because again there are a lot of people who will start to question their faith in God na inika koi ki like oh inika bimar khan do isor lage isor la nupura kane nuliwi prayer khan nukura kane inika hwa ase so a lot of stigma is definitely associated with it
okay doctor to trauma mental trauma okay manu ki to accident nole family ki ba accidents kan hoi jaise to time de tai tala bhavana khan nole like the traumatic the situation de jai na takhan ki kine ke tahan karne bi cure asna nahi ho
Yes, definitely. Tahan kaniwi cure ase. Like I mentioned regarding psychologist counseling, takhan counseling khan bi jaw paruo aro manu khan ki trauma khan face kurishe kuliwi different people react in different ways. Na to it's never specific. To symptom la opor de medications are available.
Okay, Dr. Althea to detox process to kiman lamba thake?
Ituro inika specific inika to nai. It's always personalized. Itu hando kichabi generalized nukure. So it all depends on the substance, the number of substance, tahan kiman amount khan khai takishe, last kicha khaishe. So it depends on a variety of factors.
अच्छा कितु अमिगन टीनेजर्स कन लोली यूथ्स कन अमिगन देखे तखन छाड़ दिवो कोई ना छाड़ देता हन so for a certain time gap एक ता छाड़ दे ओली बार relapse हो जाए ना तो इतु लो दे लोग किबा अपनी tips नोली किबा दिवो पड़ो like इनेगा time जे तखन के नेगा इतु face करो लगे
Inika handero like if the person starts having craving na like khawala icha inika han thakshikuledo they should always go and speak to their family about it na because itu inika hoina day by day problem he bishi hoi thakibo aro ekbar relapse kan hushikuledo aro we diktar hoi jabo aro we future de relapse wala chances can be bishi hoi jay to initially right when you start to see the initial problems that's when you should start that's when you should seek help
mental health improve करो ले करने की करो लगे लोग कोई दिवो पड़ो
mental health improve kuro kane to multiple steps thake number 1 to having a regular schedule time table thaka utu khan ke follow kura time te uthule time te ghuma aro bhalra having a balanced diet exercise khan kura aro most importantly though pray kura alak ways khan the by listening to motivational speech aro staying away from social media as much as possible ajikali mohando dikhe facebook nolibi instagram kande uku post kan ahishigule do manukan everyone is ready to share their opinion holibi sometimes we do pass some hurtful comments as well aro inika time kande do we don't know what the other person is going through aro utu manu inika hurtful comments kan puruo aro sai thakiwo nolibi tahan la family khan be sale do you can like they will be going through a hard time so sometimes if we have nothing good to say then I think we should not say anything at all
okay Dr. Althea अपनी लो दे appointment नोले अपने के lock करो मुंजा से consult करो बोले किन्ने का करो
Moiro Faith Hospital they ase so they can come in between 9 to 4 p.m. On Monday to Friday and then on Saturday I'm here between 9 to 2 p.m. Aro oku query kan thakshigule do the Faith Hospital number the reception number ki call kurna vi hudule parbo or they can get an appointment.
Thank you for being with us. Thank you.